Good afternoon. On behalf of the Chicago Regional Director, Marilyn A. Sanders, I would like to thank you for joining us for today's Data Summit on accessing community health needs for healthcare workers. We're delighted to have you with us to broaden your knowledge during our expansive Data Summit series. My name is Janine Beasley, Partnership Coordinator for the Chicago region, and I'll be your host for today. Before I go into the agenda, I'd like to cover some basic information and house rules. This summit is being recorded for the benefit of attendees and other stakeholders who are unable to be present. For those who do not wish to be recorded, please take this time now and opt out. Due to the number of participants on today's webinar, we have muted everyone's line. If you have a question, we encourage you to utilize the chat. In case we're not able to answer all your questions, please contact ask.census.gov. For any media inquiries regarding apportionment or redistricting, please reach out to our Public Information Office at pio@census.gov. For your convenience and future reference, all participants will receive a PDF of today's presentation within 2 business days. And remember, this webinar is being recorded and will be available at a later date. So what's the objective of today's Data Summit? Today's session will help those producing community health needs assessments learn how to obtain the most current demographic data for your communities. We will also introduce important statistics about healthcare access, income levels, and educational attainment. At the conclusion of today's session, you will have an increased awareness of the vast data products available through the U.S. Census Bureau. You'll be better equipped to utilize some of the free online tools available on census.gov. And you'll have resources and toolkits to assist you with navigating data on our website. Now let's walk through today's program. Our agenda will include opening remarks from Ellisa Johnson, Assistant Regional Census Manager from the Chicago region. Ms. Johnson will then introduce our Chicago Regional Director, Marilyn A. Sanders. Following Mrs. Sanders, we will welcome our census partner, Dr. Ashley Davis, Executive Director from the Arkansas Center for Nursing in Little Rock, Arkansas. We will then introduce our presenters for the day, our Census Bureau Data Dissemination Specialists, Ileana Serrano and Tony Pitchford. After our key presenters, we will have our Q&A session, and I'll wrap up today's program. Before I turn it over to Ms. Johnson, I'd like to provide a high-level update on the 2020 census. The Census Bureau released the first results from the 2020 census on April 26, 2021. As you know, every 10 years, the Census Bureau takes account of every person living in the United States as required by the Constitution. Our goal is to count everyone once, only once, and in the right place. This national head count is used to distribute the 435 memberships or seats in the U.S. House of Representatives amongst the 50 states based on the state apportionment population counts from the 2020 census. These first results from the 2020 census included 3 tables of population counts from the nation in each of the 50 states. For apportionment population counts, these are the counts used for apportionment. They include the resident population for each of the 50 states, plus each state's overseas population count. We also have the resident population counts. These are the counts of the people who are living in each of the states as of April 1, 2020. And lastly, our overseas population counts. These include each state's overseas population count. The overseas counts are usually for apportionment, and they include military and civilian employees of the U.S. government who are stationed or signed outside the 50 states and the District of Columbia on April 1, 2020. We will also include their dependents living with them overseas, who could be allocated to a home state based on administrative records from their federal agencies. We also publish resident population counts for the District of Columbia and Puerto Rico. However, their populations are not included in the apportionment population because they do not have voting seats in the U.S. House of Representatives. For more information on apportionment, including links to our latest updates and informational materials, please visit the Apportionment Press Kit located in the newsroom on census.gov. Now, the Census Bureau provides states with the local area population counts that they need to redraw or redistrict their congressional and other legislative boundaries. States are expected to receive redistricting data by August 16th. The full redistricting data with toolkits will be delivered by September 30th, 2021. For more information on redistricting, including links to geographic support products such as maps, tables, and files, please visit the Redistricting Press Kit in our newsroom on census.gov. Now let's continue with our program. I'd like for you to help me welcome the Chicago Region Assistant Regional Census Manager, Ellisa Johnson. Starting with the Census Bureau in 2008, Ms. Johnson has held roles as Data Dissemination Specialist for the state of Illinois, National Partnership Coordinator during the 2010 decennial, and Assistant Regional Manager before her promotion to Deputy Regional Director over our partnership team for the 2020 decennial. As the leader of more than 200 partnership team members, she has worked with high-level partners and networks, including our state complete count committees, and ensured the formation of partnerships in our large cities such as Chicago, Detroit, Indianapolis, and St. Louis. Please help me extend a warm welcome to Ellisa Johnson. Ellisa?
Thank you so much, Janine. I certainly appreciate the introduction, and I want to welcome everyone here today to our Data Summit. It's such a pleasure to be here. Again, my name is Ellisa Johnson, and I'd like to welcome our partners around the Chicago 8-state region and all of our partners from around the country who have joined our call today. Thank you so much for joining, and we hope that you enjoy our Data Summit today. This afternoon, I have the distinct pleasure of introducing Marilyn A. Sanders, our Regional Director for the U.S. Census Bureau Chicago region. Her extensive career spans well over 4 decennial census and multiple survey data collection innovations and improvements. Mrs. Sanders has served in many different capacities, and her extensive knowledge of field data collection has been an invaluable asset to the U.S. Census Bureau of the Chicago region. Outstanding leadership continues to move the region successfully across many platforms within the Census Bureau. To date, Mrs. Sanders has received many commendations during her 4-decade career, earning 3 bronze medals in 1992, 2000, and 2011, and the Presidential Hammer Award in 2010. She has been nominated twice for Federal Employee of the Year for her outstanding public service. We are very fortunate to have her leadership here in the 8-state region in Chicago. Ms. Sanders has a strong commitment to excellence in mentoring and understands that these qualities are pivotal in the success of the Chicago region. Ms. Sanders earned her Bachelor's of Arts degree in Business Management with a concentration in economics from Stillman College in Tuscaloosa, Alabama. She attended the University of South Alabama and Governor State University, pursuing a postgraduate studies in geography and statistics. She is a proud member of the Delta Sigma Theta sorority. Please help me welcome our Regional Director, Marilyn A. Sanders. Thank you so much. Mrs. Sanders, I'll turn it over to you.
Thank you, Ellisa. Good afternoon, everyone. On behalf of the United States Census Bureau, I want to welcome you and thank you for joining us today for our 2021 Data Summit series. I want to first extend a special thanks to my fellow regional directors, George Grandy Jr. in Atlanta, Kathy Lacey in Denver, Dallas, Julie Lamb in Los Angeles, Jeff Baylor in New York, and Fernando Armstrong in Philadelphia, as well as a thank you to our partner organizations who helped promote this event throughout your networks. Being on the front line, healthcare professionals, you took on an enormous challenge to confront the COVID-19 pandemic, and that work is still ongoing. I want to personally express the admiration, respect, and gratitude of everyone here at the Census Bureau for all that you have done during the 2020 census. Your efforts made it possible for us to conduct the decennial safely, and your partnership to promote a complete and accurate count in the communities you serve, which was critical and invaluable. As healthcare workers, you know how important it is to run the test and to look at the numbers when you are caring for a patient. Census data works much the same way for policymakers who use census statistics like the average age of the population to help set public health guidelines. Census data is also used to direct federal funding and grants, which support the healthcare institutions and nonprofits throughout the country. Today's presentation will help you to better understand how you can access census data, including the American Community Survey, to better access public health needs in your community. Along with our professional data specialists for the Census Bureau, we are so delighted today to have with us Dr. Ashley Davis, Executive Director of the Arkansas Center for Nursing. Thank you, Dr. Davis, for your contributions during the 2020 census and for joining us to share your expertise and insights. So, whether you are a new user of census data or an experienced census data user, I believe and trust today that you will find today's summit useful and informative. If you have any questions after today's summit, please follow up with our Census Bureau Data Dissemination Specialist or with our Census Partnership staff in your region. We will be more than happy to assist you however we can. Thank you all for attending today. And Janine, now I will turn it back over to you. Thank you.
Thank you, Mrs. Sanders. We're so grateful for your leadership here in the Chicago region, and your remarks have definitely set the tone for today's program. Our next speaker is Dr. Ashley Davis, who is the Executive Director of the Arkansas Center for Nursing, where she also oversees the work of the Arkansas Action Coalition. The Arkansas Center for Nursing is Arkansas's only nursing workforce center and serves as the state data clearinghouse regarding nursing workforce supply and demand and nursing education. With more than 15 years in nursing education, Dr. Ashley holds a PhD in nursing, and her research was focused on the mental health needs of nursing students. Please help me welcome Dr. Ashley Davis. Dr. Davis, you have the floor.
Thank you so much for that warm welcome. And the Arkansas Center for Nursing is one of 35 nursing workforce centers that are a part of a national group called the National Forum of Nursing Workforce Centers. Each one of those centers, we really, our main focus is to make sure that the nursing workforce is sufficient in number, but also in skill and ability to meet the needs of our individual populations. So in Arkansas, obviously, we're focused on meeting the needs of the citizens of Arkansas. In the early 2000s, that focus looked more at the numbers of nursing as we received reports that we were approaching a nursing shortage due to the aging population of nurses and the general population. As we have gone through this last year and a half, it has really brought to light a lot of the issues with health equality and health equity. And what we know is that a nursing workforce that matches the population, the demographics of the population that they serve, is much more equipped to meet the individual healthcare needs of those citizens. So when I started in my position, we looked a lot at just the numbers. So we looked at the different counties in Arkansas, and we would do a comparison of how many nurses per 1,000 population. Arkansas is predominantly rural, so we have areas that are vastly underserved by healthcare professionals. And so those numbers have been very vital as we have produced programs and gotten funding for programs to send nurses, qualified health professionals, to those underserved areas. But as we look to the future and the newest National Academy of Medicine Future of Nursing report that is in the process of being released, we know that our focus is now going to look at the demographics of that population. I can speak for Arkansas and say that our nursing workforce does not match the population that we serve. And we get that information from the census data. For example, in Northwest Arkansas, we have a heavy population of Marshallese citizens. They have unique healthcare needs, they have unique cultural norms, and even language barriers that only healthcare workers that understand and are a part of that culture can really help navigate. So with the census data, we now know that we need to increase the number of Marshallese nurses in that area. The same thing goes for some of the central Arkansas urban areas where we have a large number of Hispanic population. And we have already seen programs that have been funded and put forth to meet the individual healthcare needs of that population. So we have used the census data in a lot of different ways, but primarily we look to make sure that we have enough nurses. So we look at the numbers and matching the individual counties with how many nurses are in that county, but really looking forward, the demographics, the age, when we look at populations that we see a higher incidence of or a higher number of those that are over 65, they require more health care. So we know that we need to increase the number of available health care in that area. But also, especially when we look towards improving the health equity of our nation, we have to make sure that our nursing workforce matches the communities in which they serve, and we can only get that data through the U.S. Census. And so those are just a couple of ways that we have used the census data, but it is absolutely integral in the work that we do and the work that the National Forum does across the nation.
Thank you so much, Dr. Davis, for those remarks. And I want to thank you again on behalf of the region for all your hard work and leadership on our Complete Count committees in Arkansas during the decennial. Now let's continue with welcoming our presenters for today. First off, please help me welcome Ellisa Serrano, Data Dissemination Specialist for the U.S. Census Bureau. She is a veteran of 3 decennial censuses with 30 years of experience, earning her the Census Excellence Award in 2005. Ellisa is responsible for building and maintaining relationships with stakeholders in Illinois and Indiana, where she's responsible for outreach by conducting data access workshops with organizations, local governments, and universities. And I'd also like to welcome our other presenter for today, Tony Pitchford, who is also a data dissemination specialist for the U.S. Census Bureau. Tony has served in several positions in the Bureau, with the Bureau, and now supports Arkansas, Iowa, Missouri for the Chicago region. As the data dissemination specialist, she helps various organizations navigate the Census Bureau's website to assist with efforts such as grant writing and research. Tony and Ileana, thank you again for being here today. And now, Tony, I'll hand it over to you.
The Census Bureau's mission is to serve as the nation's leading provider of quality data about its people and the economy. We honor privacy, protect confidentiality with scientific objectivity. Our strong and capable workforce and our abiding commitment to you provides data with the assistance of residents across this country. We can only do this when you, your neighbors, and friends respond to our field representatives. For your diligence, we thank you. Collecting data on health is in direct correlation to assessing community health needs. We hope our presentation today will provide insight to the array of data available. Let's get started. Health statistics are increasingly important in measuring the nation's overall well-being. The Census Bureau provides accurate, detailed, and up-to-date statistics covering people and businesses relating to health in America. This presentation will introduce you to several surveys and programs that provide health statistics to aid in community health needs and assessments and the tools available to access information related to health care. First, we will start with the American Community Survey, or ACS, as many refer to it. ACS is an ongoing nationwide annual survey that shows what the United States population looks like and how the population lives. ACS produces characteristics of the population and housing in the United States and Puerto Rico. So instead of counting the entire population just once a decade, like the decennial census, ACS surveys a sample of the population every year to create statistics of our states and our communities at varying geographic levels. This data is collected continuously throughout the year, including and during the decennial, to produce annual social, economic, housing, and demographic estimates. ACS products are released about 1 year after the data is collected and are released in the form of 1 and 5 year period estimates. This is important to remember when searching for information. Key dates to keep in mind are the ACS 1 year data for 2020, which will be released in September, and the ACS 5 year data for 2020, which will be released in December. If you notice throughout the slides, you will occasionally see a red box. That is just a highlight for you to remember. So, what are period estimates? As the survey collects data over a period of time, 1 year, 5 year, this is known as a period estimate, as opposed to the decennial census, which reflects a point in time. One-year estimates combines data collected over a 12-month period, and it is available for geographic areas with a population of 65,000 or greater. The 5-year estimate combines data collected over a 60-month period, and it is available for all geographic areas. With all the data available from the census surveys and programs, it is important to understand that not all data is available for all geographies. What you are looking at is a diagram of the hierarchy of census geography, in particular to some of the geographics for which ACS data is available, and the relationship between them. Lower geographic areas fit neatly within the larger areas directly connected with lines. For example, schools, congressional districts, and state and legislative districts fit neatly within states and do not cross state boundaries. However, they may cross boundaries of counties or metropolitan areas. In this visualization, you can see the smallest geographic boundary building block is the block group level. Content as gathered from the questions asked on the ACS questionnaire can be grouped into 4 main types of characteristics: social, economic, demographic, and housing. Each one of these can be associated with health and an individual's well-being, both physical and mental. Social characteristics include topics such as educational attainment, language spoken at home, migration, and disability status. Economic characteristics include topics such as commuting, occupation and industry, health insurance, and more. Our ACS collects basic demographic characteristics such as age, sex, race, Hispanic origin, and relationships, which is the same information we collect on the decennial census form. Our housing characteristics include topics such as tenure, housing cost, utilities, computer and internet use, and more. Again, each of these areas of data collection has an impact on the health of individuals. Let me give you an example. When we discuss employment, health is a part of one's work experience, especially for individuals with disabilities. This slide is an example within the Chicagoland area of how accessible employment is to those with identified disabilities. With access to disability status, type of disability data, and work experience data, you can view statistics such as work experience by disability status and type for your geographic area of interest. Excuse me. Now let me introduce you to the Current Population Survey, also known as CPS. This survey is sponsored jointly by the United States Census Bureau and the Bureau of Labor Statistics. CPS is a national, cross-sectional, monthly survey which is the source of official statistics on labor force for the United States. In addition to being the primary source of monthly labor force statistics, the CPS is used to collect data for a variety of other studies that keep the nation informed of economic and social well-being of its people. This is done by adding a set of supplemental questions to the monthly basic CPS questions. Supplemental inquiries vary month to month and cover a wide variety of topics such as child support, volunteerism, health insurance coverage, and school enrollment. Supplements are usually conducted annually or biannually, but the frequency and the recurrence of a supplement depends completely on what best meets the needs of the supplement's sponsor. Notice the red box again for key dates. September's release is income, poverty, and health insurance. We will release in November data on families and living arrangements. Next is the survey of income and program participation, which is the premier source of information for income and program participation. SIPP, as it's referred to, collects data and measures the change from many topics, including economic well-being, family dynamics, education, assets, health insurance, child care, and food security. The survey of income and program participation is a household-based survey designed as a continuous series of national panels. Each panel features a nationally representative sample of interviews over a multi-year period lasting approximately 4 years. SIPP is a source of data for a variety of topics and provides for the integration of information for separate topics to form a single unified database. Government policy formulators depend heavily upon SIPP for information on the distribution of income and the success of government assistance programs. SIPP collects information for the assistance received either directly as money or indirectly as in-kind benefits. SIPP's data provides the most extensive information available on how the nation's economic well-being changes over time, which has been SIPP's defining characteristics since the inception of the program in 1983. A program I'd also like to introduce to you is the Population Estimates Program, PEP. It produces estimates of the population for the United States, metropolitan and micropolitan statistical areas, counties, cities, towns, as well as Puerto Rico and their municipios. These annual estimates are the official intercensional population and housing numbers. Demographic components of population changes, births, deaths, and immigration, and they are produced at the national, state, and county level of geography. Additionally, housing unit estimates are produced for the nation, our states, and counties. Again, the red box identifies key data which is to be released. In 2021, we will release national and state data. For the year of 2022, in April, we will release county and metro micro areas. In May, cities and towns, as well as housing units. And in June of 2022, we will release national, state, and county demographics. Now, with our health situation in the country as it is today, with the arrival of COVID-19, the United States Census Bureau, in collaboration with multiple federal agencies, was and is in a unique position to produce data on the social and economic effects of the coronavirus and the effects upon our American households. The Household Pulse Survey is designed to quickly and efficiently deploy data collected on how people's lives have been impacted by the coronavirus pandemic. This is done through a series of questions that evolve as conditions on the ground change. This slide is a visualization of the impact or the likelihood of evictions for foreclosures for Illinois and Michigan, which in reality could have a major impact on the health and mental health of individuals. It is also identifiable across the country. The Household Pulse Survey now has a vaccination tracker. This gives us information on the rate of vaccinations as well as reasons for the hesitancy some may have to the vaccine. Our community resilience efforts. The community resilience estimate is the capacity of individuals and households within a community to absorb, endure, and recover from the impacts of a disaster. Although it's relevant for all types of disasters, the current community resilience estimate identifies risk factors associated with COVID-19, as well as identifying populations with risk levels that are low, medium, and high. The risk factors, as shown on this slide, are used in several ways. It identifies ages 65 and above, low-income households, single caregivers, householders, household communication barriers, employment status, disability status, physical crowding, lack of health insurance, respiratory diseases, heart disease, and diabetes. Now let me talk to you about the COVID-19 Data Hub. This was designed to help federal agencies, businesses, and communities make decisions regarding the COVID-19 pandemic. For example, the data equality tools, the Census Bureau's publicly available data sets and tools can assist federal agencies and other entities in the equitable distribution of resources and identifying underserved communities. Our community resilience estimates, as we just covered, estimate the risk factors relating to the ability to recover from a disaster. Our Opportunity Atlas is a comprehensive census tract level data set of children's outcomes in adulthood using data covering nearly the entire United States population. And our longitudinal employer household dynamics provides details about America's job workers and local economies. The Census Business Builder is a suite of services that provide selected demographic and economic data from the Census Bureau. And of course, the Response Outreach Area Mapper, known as ROAM, identifies hard-to-survey areas. The Pulse Survey has data that helps COVID-19 impact for planning. This helps with demographic and economic data. At a glance, it allows you to select the state or county of which you're interested in. And did I mention that the COVID-19 Data Hub is located in our census.gov website? Another resource for community assessment needs can include the United States Bureau Small Area Health Insurance Estimates. This program produces the only source of data for single-year estimates of health insurance coverage for all counties in the United States by selected economic and demographic characteristics. SAHI, as we call it, releases estimates of health insurance coverage by age, sex, race, Hispanic origin, and selected income categories. The estimates can be used to examine the location and concentration of those with or without health insurance. An additional resource is the United States Census Bureau's Small Area Income and Poverty Estimates Program, which produces single-year estimates of income and poverty for all states and counties, as well as estimates of school-aged children in poverty for all 13,000 plus school districts across the country. Lastly, the economic census. The economic census measures the nation's economy every 5 years, providing vital statistics for virtually every industry and geographic area in the country. Economic surveys are conducted monthly, quarterly, and yearly. They cover selected sectors of the nation's economy and supplement the economic census with more frequent information about our economy. These surveys yield more than 400 annual economic reports, including principal economic indicators. We are your source for data, and this presentation is only a sample of how to find data that will assist you in assessing community health needs. It is our hope that we have piqued your interest in census data and encourage you to go on our various websites. Take a look around. You will be amazed at the available data. Health affects each and every one of us, whether we live in rural or urban communities. With access to economic data, you can look at who our healthcare workers are in the healthcare industry. As an example, here is a visualization for you to look at of the type of data that you can retrieve. This one shows you our health and social assistance workers by detail industry. I will now turn this segment of our presentation over to my esteemed colleague, Iliana, who will demonstrate our website. Iliana, I'm turning it over to you.
Great, thank you, Tony. Good afternoon, everyone. And for this next portion of the webinar, I'd like to focus on how you can access census demographic data, especially from the ACS, for information related to healthcare. And not only will we show you sources and topics offered from the ACS, but also highlight for you some of the most popular data access tools to help you look and access and extract that data. We are going to explore some ACS health insurance coverage data. We're going to look at some income, poverty, and educational attainment, or just education data as related to your healthcare, and also topics on how to look at healthcare data from the industry and occupation. We have a lot of tools, and we're not going to cover everything today. What I intend to do is show you some of our most popular and also our most easiest data tool that you have available for you. So you are currently looking at our splash page of census.gov, and you will access the data tools by coming to the top and clicking on the Explore Data label. One of the tools that I'm going to highlight for you is located right here in this lower panel, which is accessing local data, and that is through the Quick Facts tool. I'm not going to access it through this point. I'm going to show you how to access it through the tab on our Explore Data main. Either way, there's no right way or wrong way. Whichever need, I guess it depends on your need, and whichever way you find easy is the way to go. So as you scroll down on that Access tab, you have access to Quick Facts here, along with some other tools of which we will kind of tour later on. So right now, just to show you how easy and comprehensive this tool is, you're just going to click on, go to Quick Facts. And right off the top, you can see that this tool brings back, it defaults to the US, but it brings back a comprehensive profile of whatever geography you are looking at. You're going to get housing data, computer and internet, education, age, race. You're looking at your health indicators, age, sex, race, ethnicity, income, poverty, education, language spoken at home, veteran status, you have it right here, marital status, employment status, care coverage, disability status. As a percentage, you can get that information on this tool, okay? And it always showcases for you the most current data that we have released. Simple to use. The only caveat is your geography has to be 5,000 or more in population. Anything lower than that, you will need to use data.census.gov. But to kind of give you a view of what it can do for you, we're just going to go on the left-hand side, and I am going to, let's look at Idaho, and I'm going to look at Arkansas, and Louisiana, let's see, Missouri, and Vermont, just so that we have a nice representation throughout the continental US. So this tool allows you to stack up 6 different geographies or 6 different places, counties, states, okay, as long as it's 5,000 and more. So we're not going to compare it to the US, so I just click on the X and it takes it away. And now you can see it always defaults to population, okay, but you have the same data for each state in the same order, right? And you can do this by place or by county. Zip code only if they meet that 5,000 threshold. What you can do also with this, if you are looking for a particular fact, for instance, let's look at the population 65 and over. Click on that down arrow, and what the tool will do for you, it will bring to the top, highlighted, that particular fact that you were looking at, that you were inquiring about. So with regards to 65 and over, you have it straight across the top for all 4 states that we have. And also it highlights it for you under its proper cohort. So you have content, okay? Some people think, okay, well, that's a lot of distracted data that's showing. I just want that one line item. You can filter it by coming to the All Topics tab, dropping the selection, and sits in the age and sex cohort. You can click on that. And what the tool will do for you is it will suppress or hide everything else and bring forward that particular line item that you were wanting, and also in the proper cohort, okay? It does also allow you to view the data in different formats. We are looking at the table format, which tells you we've got 4 geographies there. You can view it in a map format, in a chart format, or in this little dashboard. If you click on it, let's go to Arkansas, and we will highlight this particular line item for Arkansas. There's a little bit of a delay here, pardon about that. But here again, you can see different formats. Here's your requested line item, and it's highlighted, and it's cohort in your table view. You've got the geographies highlighted in your map, and down at the bottom, the legend is broken out, a representative of the data that you have selected, the data point. And then below it, you have a chart that has comparison stats, if you will, across the nation. Highlighted geography are those that you have selected. This tool will allow you to, if you go to that last little widget on the right-hand side, it will allow you to print the data tables from which this is being extracted. You can create a CSV, email the link, embed it if you like, and share it on social media. And after today, if you kind of forget how set your geography or use the map or use the filters, you can click right up on top where it's got what's new and FAQs, and it will walk you through step by step what you need to do to work the tool as easily as possible. Okay, so now on the left hand side, sorry, I'm going to hit the icon, the census icon, and we're going to go to our Explore Data tab and enter main. And what we're going to look at now is our next tool, which is the COVID Data Hub, okay? The COVID-19 Data Hub. Click on the panel, you got to come up to the top, activate it, clicking on that bar. And so here is, and there's a lot of information here, so I do invite you at your leisure to definitely open up these tabs and explore what's in there, because you will find a lot of helpful information and interactive tools. So the first one is that I'm going to open up for you are the data equity tools. Okay. Going to show you entry points for different data tools, I should say, depending on what your need is. Now, Tony kind of gave you an overview of what the community resiliency estimates are. This is your entry point. We do have little videos here that will give you a better tour of what I'm doing today, but it'll give you a better tour of what the tool is and how you can probably apply it to your needs. The ROAM Response Outreach Area Mapper was used extensively during the 2020 census, because what this tool does is it identifies areas that are traditionally hard to count, meaning that we have low responses in those areas, low participation rates for survey work. So that's usually indicative of a challenge, be it economic or education or language, whatever, it's a challenge. And this map helped us identify those hard to count areas so that we can do our outreach and tackle it in a very specific way. You have your opportunity atlas, and below, if you tour down, you have the LEHD, which gives you employment dynamics. And so if you're in labor force for the healthcare field, you could look at this and definitely extract some information from it. And also Census Business Builder. Very easy tool to use, and it would allow you to look at economic data, industry type data for the healthcare field. Okay, like I said, this is only a few of the tools that we have available, and I invite you to explore them at your leisure, because I know you will find something to use from here. Another part that I wanted to highlight is the data sets, highlighted data sets tab. Come in here and you've got very specific publications and interactive data that you can look at: people below poverty, income, over 65, keep going. You've got NAICS service food industry, non-employer, and payroll. Lots of information there. And below you have a little compilation of our partners in other agencies that have teamed up to produce this information for you. Okay, going back to the COVID site, another one that is very insightful, if you will. Okay, this is the actual tool itself, but right here in this tab, the categorical data searches. Okay, here, if you are zeroing in on a specific topic or variable for your assessment needs or your research, here you can go straight and get your demographics, characteristics on housing, social, economic, business, and employment. Again, I'm not going to show the case this because it is kind of involved, but I'm inviting you to tour this on your own. Okay. And so now at the top of the COVID-19 data hub is my favorite, which is the impact planning report. Okay. This one will allow you to select your geography and or if you like county. So if you want, you can go to, and let's tour Arkansas as a state, and it will redraw the map and populate it with data pertinent to Arkansas. And you're getting high level data up on top, but now on the tool, you are getting all of these high level information from business, key facts, occupation, population 65 and over. A couple of things you can do with this. You can filter a particular panel to the metrics that you are looking for or wanting to highlight. And also if you use a little cog or the gear, you can view the table that has this data. Important in viewing the table is sometimes you get the table ID, and that is what you can use in data.census.gov to come back and look at the same table, okay, in a much more drill down fashion, if you will, or much more broader view, if you will. Okay, you can, using the little icon here, you can export the information, you can print it. But my favorite part is on the second page, which really here comes down to the nitty gritty of our indicators. You've got languages spoken at home. You've got Hispanic, origin, and race. Population and poverty status. If you want, you can, there's a little arrow right there that you can hit, and it will allow you to scroll down and look at the entire cohort of that data. You've got poverty levels, other population facts, school enrollment, very important, and those without health insurance. Again, comprehensive, and you can come down and say if you wanted to look at a different, you don't want it by state, you want it more localized, you can go, I'm going to do Illinois, and then I'm going to go, say Boone County. And so now you have your geography identified, Boone County, Illinois, and then all the data pertinent to COVID impact. Okay, so good tool to use to give you a high level overview of the conditions in your area or gain some insights into that particular geography. Okay, from here, there's also access, if you scroll down, to some additional tools. Again, community resiliency. If you're looking for comparisons of international data to US data, national data, we have the International Population Clock, or database, I should say, that will give you a lot of international data that you may want to use in your reports. The one that I wanted to highlight for you is the weekly household pulse survey. Okay, just click on it. It will allow you to come in, and from there you've got different things that you can do. You can look at tables, public use files, the interactive tool, which will go in a moment, or currently, because of the vaccination hesitancy that we have in the nation, you can track by state. Well, right now it's a national production here, but you can look at interactively, okay, what the rates are, who's high, who's low. And then if you look at the hesitancy, it will give you information on why. Definitely not get the vaccine, probably not, unsure, probably, and also information on the question, the survey itself. Okay, so that's the pulse survey. We're going to go up to, again, our data, explore data tab, and go into the data main. And now we're going to look at our data.census.gov. Okay, this is the premier extraction tool. This is where decennial data will be released from, and you will have access to it. And this is where all the ACS and economic data is residing right now. The current historical, some of it is on the API, but This tool offers you different ways of accessing the whatever data you're looking for. If you're a casual user, a novice, or an experienced data user. For the novice or the casual user, you don't have to go into the advanced portion. If you've got a question or a data topic, you can key it right here. For instance, I am going to look at, where's my key here? Percentage of population with no health insurance. Arkansas. Okay, and I'm just going to hit return, and right off the bat, the tool is bringing back data for you. Depending on what it is that you're looking for, on the right-hand side, you have access to a complete profile of the state of Arkansas. You've got related searches if you are so inclined to go and target disability or health. And on the left-hand side, you have the data that we had asked on our query. 9.1% of the population in Arkansas has no health insurance, okay? But below it, you have related tables that will give you characteristics, okay, selected characteristics and additional other related surveys and program data on that particular topic. If you scroll down, you can access additional tables, of which there are about 83. And down at the bottom, you can even map those variables using these links below. But what we're going to do, so you can see what the tool does, going to come in right on our question answered, our table. Okay, so now you are at the table view of that particular data table. And we asked it, what is the population with no health insurance in Arkansas? Here's my geography. And you have the age breakouts, male, female. You've got some other characteristics, race and Hispanic origin, living arrangements, so on and so forth, disability, employment. You've got a lot of data here, okay, other than just no health insurance coverage. But you've got the insured column here, and on the scrolling over, the uninsured. Okay, so say you wanted to target 26 to 34-year-olds, okay, in Arkansas who are not insured, you can highlight that. And right now it is telling you, or it is showing, that 17.4% of that particular demographic group, age group, has no insurance. Okay, and with this, you can highlight that particular line if you so wish, and then do a right click and copy and paste it. Or if you want, you can customize this data table if you so like by coming over to the right-hand side, click on that, and let's say, for instance, you're okay with the margin of error, but you don't necessarily need it in your spreadsheet. You can use the icons at the ribbon to hide that particular data point, okay? You can also, if you like, condense the table by moving the rows, clicking on these three little bars and saying, okay, adjust all my columns to that, giving you a very nice, concise table, and shrink that a bit. And with this, you can print, okay? Printing capability is not exactly like a PDF. It will give you printing capabilities, but limited amount of columns, and it only prints what you are viewing. If you have the second page, you will notice it will give you data notes. So careful with the printing, be meticulous and targeted in terms of what you need to print. But you can download this, okay, table, and it will ask you if you want all the data sets, all the years, the 1 year or the 5 year, or you can cherry pick your specific ones, okay, to download. And or if you like, you can do an Excel and do, export it to a CSV, or export it to an Excel so you can drop it in whatever statistical analysis tool you may have. Okay, couple of little things here using the customization. But let's go back to our table because I also want to show you that once you have it here, you can also add geographies so that you can do your comparisons or your deeper dive into the particular variable that you're looking at. So if you go on the filter on the left-hand side, here you have an overlay of things that will allow you to customize additionally that table. Here we have our data chips of how the table was created. But now say I wanted to look at all geographies, I should say all counties across Arkansas. We have our primary geography. So now I'm going to come to the middle and say, okay, I want county level. And it's going to ask, where are those counties in Arkansas? And here you have the option of cherry picking whichever county you want. I'm going to say, let's look at all counties in Arkansas. And so I'm done. Go over to the right, click on that. And so now I've got county level data. Okay, but you're noticing, we know just from that list that we just saw that Arkansas has other counties that start with the letter A. So why aren't they showing up on this table view? Because if you remember what Tony had talked about earlier on our geographic, on our products, you have geographic or population thresholds with these data sets. It pulls back for you the most current, and the most current is always the 1-year estimate. So you have it here. If you want all the other counties that fall below that 65,000 population threshold, drop down the arrow and you will need to select the 5-year estimate. Okay. So now you have all your counties, and it's a large file, so be careful with downloading because it may ask you or may tell you too large, can't do it. You can't view it, but you can download it. But here you have a complete profile on the characteristics of the uninsured, and if you want those particular items or age groups that you would like. This is your table ID. And with this tool, you can look at the data just by entering the table ID and then customizing it to your geography. Okay, so if you have a favorite data table that you stumble across or you know or someone sent you, use that to access that data. But also what I want to show you is on the left-hand side, you have other related tables that I invite you to explore. It's all on the healthcare coverage. So if we look at this one, you are looking at selected characteristics of the uninsured, okay? And it's particular the geography that we just selected. And it gives you, again, different information. It's taking its time loading up. So hang on, it'll come up. Considerable delay here. Okay. Refresh. Let's see. Okay, I don't know what's causing the delay here, but again, these are different ways that you can look at data. And I also invite you to look and explore the ones that come up on the left-hand side that have relatable data, okay? So from now, let's go back out to the outside and let's look at healthcare occupations by sex. And I'm just going to do the casual search. So here we have occupation by sex for the civilian employed. I'm going to pop in there. Again, we haven't told it its geography, so it defaults to the US, but as you scroll down, here you find healthcare practitioners, diagnosing and treatment, technologies, and service occupations. You have health support. So there, with the tool, you can look at data for your healthcare workers as well as the people that the healthcare workers treat, right? So we are going to filter, and let's see if we can go somewhere else. Let's see. Let's go to, I'm going to state to state. Let's do Arkansas. I'm going to come down here and do Indiana. Stretch out to Massachusetts and down in Mexico. Okay, it's done. Come over to the right. So now I have state data and I can look at my healthcare workers. And to address the point is, do we have enough healthcare workers to service that population? This will give you a good indication. Okay, as you scroll through, you can see who has what, okay, and how many, right, on this. Another beauty of this tool is if you are really interested in highlighting these data points, you can map your results. And by that, all you need to do is click on the map icon on the upper left, or when you go to your customize table, click on that map icon. Let's go to maps. Okay, so again, my geography is kind of spread out, but it's giving you highlighted the areas that we have selected. Now we haven't selected a topic yet to highlight, and this is what you're going to do when you come up to the topic line. Drop down that selection, and this is where you are going to scroll through and select. Okay, let's do healthcare support. All right, so your legend recalculates for that specific variable. And with this, if you wanted to add here, looking at it, and you wanted to add another state or take out another state, you're able to do that. Come over to the upper left, hit your selection tool, and you can add that to your geography, or you can come in here and delete the one that you are no longer interested in. Or you can use a square, or what they call a polygon. Only problem with this is if you, whatever geography that line hits, it's going to take. So if you didn't mean to bring in South Dakota, you still have that option of clicking on it and deselecting. Okay, whatever you select here, it will add to your table. You can also, customize your data set here in colors and such. What we're going to do is go back and look at the table so you can see how it brought over the data for the geographies that you have selected. And again, it's quite an extensive table, but it does give you indication of your healthcare workers. Now, I just went in and I did this as a casual search, but for those of you who are familiar with this tool, you can also look at it through just using the filters, okay? So what you could do without the search is you're looking at topics, then go to employment, and we're going to look at occupation. Again, this is the area, these topics, the way they break out and they partition off. I invite you to come in and click on every one of them because they do contain additional selections, additional variables that are helpful. Okay, so since we are in employment, one thing about these selections, if there's a box next to that selection, that means you can't go any further. If there is no box, if you click on that, it's going to give you additional selections. And those that are grayed out are not available at this time. Okay, so we're going to do occupation, and I'm going to do search, and it's going to give me that data table, occupied. And I didn't give it a geography, so it's going to default to the US, but I think you get the gist how you can set up your geography for that. Okay, so with that, We can go back and look under advanced, do the same thing for looking at, if you want, poverty and income. So see, geography, I'm going to do Missouri. I'm just going to tour Missouri. Yep, back here. Okay. And under topics, I'm going to look at income and poverty. And for this particular one, I'm just going to select poverty data. Okay, search. Again, related tables, come up to the one that is highlighted. And what I wanted to show you here is how you can drill down not only to the county, but to the tract level, which is what people like to look at when they're really looking at or targeting a specific area. So we have Missouri. I come into my filter and I'm going to say, okay, let me look at a particular county that I want to see. And we've got in Missouri. You've got all of your counties there, and you can go down and select the ones. But if it's all the way down at the bottom, what you can do is click on the magnifying glass and just click on key in a couple of letters, and it will bring up the county for you. You select it, and it's set. So now I have Missouri, but as you notice, where's my Benton County? It's not showing up. Again, data product. Click it, use the 5-year. Okay, so now as we scroll over, there's Benton County, right? So now we're going to map this. And this is how you can overlay the tracks for this particular county. You're going to come up to the geography line on your map view, drop down and scroll until you find census tract. Right? So those tiny numbers are your tracks, and using your selection tool, you can click on the ones you want or just specifically those two. Right? Here's my tract. Now, if I go back to my table, here's Missouri, Benton, and as you scroll over, there are my tracks. Okay, and it's not necessary. Once you do that, you can take out the state and you can take out the Benton, the geography. You can delete those and just keep your tracks, whatever it is that you want to do. But it offers you different ways to look at your data at different geographic levels, depending on the population threshold. That is one thing that you need to keep in mind, that not all data is available, given the population threshold, and also our privacy concerns, mitigations that we put in place to protect the respondent's identity. Okay, so with that, I think I am done. I will turn it over to Janine.
Thank you, Ileana, for such a comprehensive overview. We have some great questions, and as I mentioned before, due to the volume of participants, we won't be able to answer all questions. And those that are not answered, please contact ask.census.gov. And please know you will receive a PDF of this presentation within 2 business days. We have actually, I have one question for you. Is this data available for Puerto Rico? Ileana or Tony?
Go ahead, we're here.
I was asking, is this information available for Puerto Rico?
From ACS, yes.
Okay, wonderful.
And ACS, I think, I'm sorry, the designation under the ACS would have an extension of PR. So then you can come in and pull that data by state or the condados or the municipios. Yeah, you can get that.
Great, thank you. And is the post-survey information available at the county and census tract levels?
I don't think on the track, Tony.
On to track.
I'm sorry, Tony, we didn't hear the complete response.
I'm sorry. It is currently available at state and county level. We have not gone to the track level at this time.
Okay, thank you both. And that's all the time we have for our questions, and really appreciate you guys presenting your questions. Again, if you do have those questions or your questions were not answered, please contact ask.census.gov. But before you go, I would like to show you some very important resources, because if you enjoyed today's summit, we have more to share to help you learn more about census data tools and resources. There's so much at your fingertips on census.gov's Census Academy page. There you can find valuable information on data dissemination training, such as today's session. There are options to request a free data training for your organization. Did I mention that's free of charge? Now, you really can't beat that. We also have our data gems, which are short how-to videos aimed at helping you increase your knowledge of census data. Not to worry, we can deliver those data gems directly to your inbox. And you can also gain access to our easy, learn at your own pace tutorials. We're really here for you at the Census Bureau. And as a personal resource, the Census Bureau has a team of specialists such as Ileana and Tony, who can assist you in bringing the world of data to you by providing trainings, workshops, and presentations, all at no cost. Now, are you interested in learning more through another Census Data Summit? Well, we have several data summits on various topics available now through August 2021. There you can find everything you need on the 2021 Data Summit page on census.gov. In the search bar at the top, simply type 2021 Data Summit Series to land on the page seen on this slide. To view them all, please be sure to click Show More and find the one that suits your needs. Believe me, it's a one-stop shop. We'll also have recordings on each session when they become available. After today, we'd like for you to stay connected with us. We really want to hear from you. We especially want to know your thoughts about today's summit, because there's always room for improvement. You can tell us what you think about today's session by contacting your state's regional office by phone or email, and I'll provide an overview of those offices in just a moment. You can also connect with your local partnership specialist for any comments or questions about today, and they'll share their feedback, your feedback, with the National Community Partnership and Engagement Program Office. For any media inquiries regarding apportionment or redistricting, email the Public Information Office at pio@census.gov. Now let's walk through our contact information for each of our regional offices. For the Atlanta Regional Office, our regional director is George Grandy, Jr., and that email address is atlanta.regional.office@census.gov. For our Chicago Regional Office, our regional director is Marilyn A. Sanders. That office can be reached at chicago.regional.office@census.gov. For our Denver, Dallas office, our regional director is Kathy L. Lacey. That address is denver.regional.office@census.gov. For our Los Angeles office, where our regional director is Julie Lamb, that email address is los.angeles.regional.office@census.gov. For our New York regional office, Jeff Baylor is the regional director. That address is new.york.regional.office@census.gov. And we have one more, our Philly regional office, where Fernando Armstrong is the regional director. That email address is philadelphia.regional.office@census.gov. Before you go, here's my contact information for any questions or comments for the Chicago region. Those states include Indiana, Illinois, Wisconsin, Michigan, Arkansas, Minnesota, Missouri, and Iowa. Thank you so very much for joining us for today's Data Summit on accessing community health needs for healthcare workers. I want to thank our Census Bureau leadership, our Chicago Regional Director, Marilyn A. Sanders, our Assistant Regional Census Manager from the Chicago region, Ellisa Johnson, and our very special guest speaker, Dr. Ashley Davis from the Arkansas Center for Nursing, and our key presenters, Tony Pitchford and Ileana Serrano from the U.S. Census Bureau. Before we close out today's session, I'd like to review our objectives for today's summit, which were to increase your awareness of the vast data products available through the U.S. Census Bureau. We hope that you were better equipped to utilize some of the free online tools available on our website. And now you have more resources and toolkits at your fingertips that will assist you with navigating data available on census.gov. Remember, we encourage you to provide your feedback regarding today's program on how we can improve on future sessions. As a friendly reminder, please expect the PDF from today's presentation within 2 business days. This webinar is being recorded, and that recording will be available at a later date. This concludes today's webinar. Thank you again for joining us. Have a wonderful afternoon.